Welcome to this video about bladder rupture, a serious medical condition where the bladder wall tears. We'll explore the causes, symptoms, diagnosis, treatment, and more to give you a comprehensive understanding of this condition. Bladder rupture can occur due to various factors. The most common cause is blunt abdominal trauma, often from car accidents, falls, or direct blows to the abdomen. This is especially true when the bladder is full. Other causes include penetrating injuries such as gunshot or stab wounds, iatrogenic injury during surgical procedures like cystoscopy or pelvic surgery, or even spontaneous rupture in rare cases of pre-existing bladder conditions such as tumors or infections. The pathophysiology of bladder rupture depends on the location and extent of the tear. When the bladder ruptures, urine leaks into the surrounding abdominal or pelvic cavity. This leakage causes irritation and inflammation of the peritoneum, the lining of the abdominal cavity, leading to peritonitis. The extravasated urine can also be absorbed into the bloodstream, potentially leading to electrolyte imbalances and kidney injury. In intraperitoneal ruptures, the urine directly enters the abdominal cavity, while in extraperitoneal ruptures, it remains confined to the pelvic space. Bladder rupture is relatively rare, but its incidence is increasing due to the rise in high-speed motor vehicle accidents and other forms of trauma. The exact prevalence is difficult to determine, as many cases may go undiagnosed or are associated with other severe injuries. It's more common in men than women, likely due to their higher risk of trauma. Children are also more susceptible due to their smaller body size and thinner bladder walls. The signs and symptoms of bladder rupture can vary depending on the severity and location of the tear. Common symptoms include abdominal pain, especially in the lower abdomen. Patients may also experience difficulty or inability to urinate, blood in the urine, known as hematuria, and abdominal distension. In severe cases, signs of peritonitis, such as fever, nausea, vomiting, and a rigid abdomen may be present. Patients might also experience pain referred to the shoulder due to diaphragmatic irritation. Diagnosis of bladder rupture typically involves a combination of clinical evaluation and imaging studies. A thorough physical examination is crucial to assess the patient's overall condition and identify any associated injuries. A retrograde cystogram, where contrast dye is instilled into the bladder through a catheter, is the gold standard for confirming a bladder rupture. CT cystography is another useful imaging modality that provides detailed anatomical information and can detect both intraperitoneal and extraperitoneal ruptures. Plain X-rays may reveal pelvic fractures, which are often associated with bladder injuries. Bladder ruptures are generally classified into two main types: intraperitoneal and extraperitoneal. Intraperitoneal ruptures occur when the bladder wall tears into the abdominal cavity, allowing urine to leak directly into the peritoneal space. Extraperitoneal ruptures occur when the tear is located outside the peritoneal cavity, usually in the pelvic space surrounding the bladder. Extraperitoneal ruptures are further classified as simple or complex based on the extent of the injury and the presence of associated pelvic fractures. Treatment for bladder rupture depends on the type and severity of the injury. Intraperitoneal ruptures typically require surgical repair, where the bladder wall is sutured closed to prevent further urine leakage. Extraperitoneal ruptures, particularly simple ones, may be managed conservatively with bladder drainage using a Foley catheter for several weeks to allow the bladder to heal on its own. Complex extraperitoneal ruptures, especially those associated with significant pelvic fractures, may also require surgical intervention. Antibiotics are often administered to prevent or treat infections. Pain management is also an important aspect of treatment. Preventing bladder rupture primarily involves reducing the risk of trauma. Wearing seatbelts in vehicles significantly decreases the likelihood of abdominal injuries. Safe practices during sports and recreational activities can also help prevent injuries. In the context of surgical procedures, careful technique and awareness of bladder anatomy are essential to avoid iatrogenic injuries. Avoiding activities that might cause injury after recent pelvic surgery is also advisable. The prognosis for bladder rupture is generally good with prompt and appropriate treatment. Most patients recover fully with surgical repair or conservative management. Potential complications include infection, urinary incontinence, and bladder dysfunction. Recent research focuses on improving diagnostic techniques and surgical approaches to minimize complications and optimize outcomes. Minimally invasive surgical techniques, such as laparoscopic or robotic-assisted repair, are being explored to reduce pain and recovery time. Research into bladder regeneration and tissue engineering may offer future solutions for complex bladder injuries.